This is another place in Cusco. It's a lovely place. Inca people developed the ability to adapt plants to different temperatures in places like this, Moray. There are several studies that shows that there are reasons to evaluate the spine in sacroiliitis. We are going to see some of them. As many as the 23% of patients with ankylosing spondylitis with clinically active disease may have spinal inflammatory lesions without evidence of the sacroiliitis. It means if we have an MRI of some SI joints that is negative, it doesn't mean that they don't have spondyloarthritis. There's another two examples. A study shows that numbers of severe Romanus lesions in patients younger than 50 years are highly accurate in the diagnosis of spondyloarthritis. Another example is the assessment by experienced readers show the spinal inflammation on MRI might be observed up to 50% of patients with non-radiological HLA without SI joint inflammation. Bennett summarized this situation like this. Evaluation of SPI is good for diagnosis, prognosis, and even the treatment decisions. What are we are looking for? This is the Romanus lesions, hyperintense signaling in the cornea of the vertebra. Another example. We need to know some observation about this. The classic signs, lesions of spondyloarthritis in MRI of the spine can also be observed in other pathologies, such as degenerative, or and also in healthy people. We need to know that because we can overdiagnose spondyloarthritis. 5% of the SPA patients with clinically active disease have no acute inflammatory lesions of MRI stir, whole spine or SI joints. We need to know that. This is another lovely place, San Valvaquín in Puerto Maldonado. What about Peru? We have three systems of healthcare in Peru: the public system, the private, and the mixed, the social security. There is no report about the incidence of the prevalence of the SPA in Peru. The same study in 2008 reports that more or less the prevalence of the people with SPA in Peru is 80,000 to 100,000. But using the ASAS criteria, maybe its population is greater. And perhaps we don't know about that. What happened with a patient with a low back pain? In a public system and in a salute system, the people who has a patient who has a low back pain go to the hospital and is consulted with a family doctor. This family doctor decides the way to make diagnosis, and maybe he think about another diseases. The most frequent situation is that the SPA is going to be delayed. The SPA diagnosis is going to be delayed. And what about the private healthcare companies? It's the same. The patient decides who the specialist is going to consult it. The most frequent symptom is the low back pain, and the low back pain is consulted with non-rheumatologists. It means orthopedic surgeons or chiropractors. And they are going to think about another diseases, especially this herniation, and the MRI without stir sequences is going to be requested. So the SPA diagnosis is going to be delayed. If the patient is consulted to a rheumatologist, he's going to ask or request the MRI, the appropriate MRI exam with stir sequences. The most protocols to evaluate these herniations include sagittal T1 and sagittal T2 sequences, But steer sequences are used only in a recent trauma, or maybe we are going to, if we suspect secondary lesions. This is the monastery, Santa Catalina Monastery in Arequipa. Let's look at an example about what I'm talking about. This is a male, 35 years old, with chronic lobar pain. He consulted with a non-rheumatologist, and he requests for exam, MRI exam. Can you see something? Something abnormal? A report without significant findings. But what happened with the patient? 6 months later, he consulted with a rheumatologist. He requests a new exam, MRI exam, and we did the sequences using the steer, and this is the images. Can you see something? We found these mild discopathies that do not explain pain. And in the protocol of SPA, we need to do the sequences on SI joints. And we found this. Hyperintense signal in the SI joints on the right and left. The diagnosis is done. This patient has spondyloarthritis. So what can we do to avoid delayed diagnosis? Keep alert. In patients under the 45 years, distinguish mechanical and inflammatory lobar pain, use steer sequences in spine MRI, and add coronal steer sequences of sacroiliac joints. The interview is very important to know which is the reason for the exam. What are we doing in the place I work? If the patient arrive to our place with an MRI exam, we interview the patient, we notice that maybe he or she or the patient has an inflammatory lobar pain, we make a little change in the protocol using the steer instead of T2. So we use the total sagittal spine steer, looking for the Romanus lesions. If we found it, we finish the exam. If we don't find them, we add a coronal steer in SI joints. If we think about the mechanical inflammatory mechanical lobar pain, we do the sagittal T1, T2, and the axial T2, looking for the discernation. If we don't have discernation, we add sequences of coronal steer in SI joints. If we are looking for, we need to find something, we need to looking for it. Can you see something there? And this is Oxapampa in the jungle of Peru. We can see these images, these animals there. There is another example. This is a guy with a patient with 32 years old with low chronic lobar pain. And the physician, the non-rheumatologist, think about a problem in the hips. And the clinical diagnosis was right hip impingement or cross-arthrosis. The exam requested was MRI of both hips. We did the exam, hips on right hip, the left hip, images of pelvis, and we added images in coronal steer of SI joints, and we find hyperintense signals. The diagnosis was spondyloarthritis. What happened if we didn't add these steer sequences? Maybe the diagnosis was delayed again. And what about when requests for ASAS protocols? This is important. We did this exam, total steer, total spine steer, total spine T21, coronal steering in SI joints, coronal T1, axial steer, and axial T1 in only 36 minutes. This is great. We can do this, and we can make a total exam trying to find inflammatory lesions. This is the protocol. We interviewed